I'm Dr. Boom. In this video, we're going to talk about the best COVID protection there is. Now, as you know, this is the second year of the pandemic, and as a doctor, I've been often asked by people, some of them are my patients, and they um, will ask me, "Hey, doc, which do you think has the best COVID protection? Those who were unvaccinated and recovered from the virus, or those who had been vaccinated?" Well, of course, both of this group of people will confer some degree of immunity, but we will probably turn to research to answer those questions. And in this research, these will answer the questions of which among this group of people will uh, eventually have the best protection. So, without further ado, we will be discussing this question. So first and foremost, these are the list of the major variants of COVID-19. So we have the Alpha variant, formerly called the UK variant. Now it's called B117. The Beta variant, formerly called the South African variant, now B1351. We have the Gamma variant, formerly the Brazil variant, now P1. And of course, everyone knows about this Delta variant, formerly India variant. Now it's B16172. And now this Delta variant, which was previously the most dominant variant, was displaced by the Omicron variant. So looking at this study, they have, the scientists have looked at those people who never had any vaccination but were infected by COVID-19. And these people recovered and their serum were analyzed. Now, the antibodies in their system neutralized the original variant, the Wuhan Hu 1, and some neutralized the B1351. Now, these people were then immunized, and they again looked at the antibody in their serum. And it showed that the neutralizing titers against all variants and the SARS-CoV-1 increased by up to 1,000-fold. Now, this 1,000-fold is very significant. So they've seen that these antibody titers were effective against all the variants. And the immunization of those who have not had COVID have shown some degree of cross-neutralizing responses, meaning that they're also effective against some variants, but comparing the titers, there were significantly lower titers. So again, people who had no immunization, got the virus, were then immunized, had 1,000-fold increase in their antibody, which were effective against all the variants, as compared to those who were just immunized, never had a COVID, and their titers were lower. So with this group of people, it is shown that those who never had the vaccine, got infected, and got the vaccine afterwards had the most effective antibodies against all the variants that was seen. And this is another study, and this time it looks at those people who were only given one dose of Pfizer vaccine. Now, keep in mind, the Pfizer vaccine needs 2 shots, and of course now we know that we needed booster. But when this study was done, it was in the early part of the pandemic, and they looked at those people who had the virus before and those who never got infected. And they looked at the antibody responses on both of these groups. Now, after one dose, in those people who had previously been infected, they noticed that the antibody response generated higher level of antibodies which were effective against two variants compared to those without previous infection. So, looking at the study, it seems the best protection there is seen in those people who never had the vaccine when they got infected and then were vaccinated after the infection. So those were the people who the studies have shown has the best protection there is. So, they probably built this natural immunity and then the acquired immunity. So, the studies have shown this this group of people were, have had the best protection there is. So, thank you so much for viewing this video, and I would love to see you in my next video. Thank you so much, and God bless.